The National HIV/AIDS Indicator Survey, with a reduction of HIV infection prevalence to 1.9% against previously speculated high figures. The Basic Healthcare Provision Fund of 12.7 billion naira for the Primary Healthcare Development Agency were some of the positive developments that attracted a lot of commendations. There also followed a facelift of some health facilities, especially at the state level, the launch of a trauma care center in Lagos, more uptake of state health insurance scheme, and the launch of the sex offenders register by the Minister of Women Affairs to tackle the increase in rape cases.
This was another beautiful move. You won't believe that about 2 million women are raped in this country in a year, which is becoming another major health issue. Another positive thing that happened last year was the National Health Bill, which was passed by the National Assembly, though we are still awaiting the President to assent to that. What that one is going to do is to say people can no longer say it is whether I like or not that I'm going to key into the health scheme thing. It's now going to be compulsory that you must have a health insurance, and this will solve a lot of problems.
On the negative note was the high instability in the National Health Insurance Scheme due to corruption, increase in disaster and casualty figures, with no adequate emergency and trauma care to save lives.
The emergency space particularly has been left as if it doesn't exist. But you and I know that day by day emergencies happen, but there is no functional, effective plan until recent time on how those emergencies are addressed. So that's what the gap we are filling. And we are complementing what the government is doing. We cooperate with the government. We are filling in the gap as much as possible. Government cannot do it all alone. More importantly, there's a resource constraints. So right now we are forging a strong partnership with Lagos State Ministry of Health. We are coming up with a program that would incorporate other stakeholders, including LASAMBOS, LASEMA, and FRS. Of course, we have an existing MOU with them to respond to emergencies effectively.
So while we're looking at spending money on buildings and ambulances and helipads and transportation systems, we also have to look at the manpower that is going to make these facilities work. So the ambulances need to be manned by a skilled workforce. We have to pay attention to awareness amongst our public so that they don't mistreat or try to help a victim of a trauma experience in a wrong way.
The year 2019 also witnessed an increase in suicide rate and a lot of disease outbreak like yellow fever, monkeypox, Lassa fever, and gastroenteritis in Lagos State.
This is the reason I believe that Nigeria has to have a dedicated research fund, especially health research, which has been contributing significantly over the years to human development, to be able to tackle all of this. So what we are doing really is limited to some of the things we're able to do in the lab, and then a few that we're able to do on the field. The most important thing is to develop vaccine against Lassa.
With the new year 2020 continuing with more infectious disease outbreak like Lassa fever and the outbreak of coronavirus in China, experts want government at all levels to focus more on infectious disease control, improve the working condition of health workers, and put a stop to capital flight through medical tourism.